there, my name is Leangari and this is the Morning Cafe right here on TV 47. Indeed, a beautiful morning. I don't know where you are at this hour, but remember you can engage us through our social media platforms. That is TV 47KE on Instagram, Twitter and Facebook. By the way, this show, we give you an opportunity to send in videos. By the way, in case you want to tell us what's happening where you are, unataka kutuambia kenye inafanyika kwa mtaa, you can send us those videos. You can even send us through our channels, that is TV47KE on Instagram, Twitter and Facebook. Of course, we'll be introducing, of course, also our WhatsApp number where you can be sending your videos. We also want to know what's happening where you are in terms of traffic. So throughout this discussion today and throughout the show, you can send us, your comments on where you are, what's happening, what's crack-lacking where you are. Let us know what's going on. My name again is Leangari. We begin today with a newspaper review and I'll introduce my guest today, Gerald Vitok, a political commentator. Gerald, how are you doing?
Good morning,
You're looking fresh, man.
Thank you.
Hustle kupita. Inaonekana traffic leo iko poa.
Traffic simba. And also, najua curfew. The only thing we've been doing in this country is sleeping. So when you get an opportunity to wake up, you have to look fresh and dapper.
It's an opportunity. Umekuwa ukilala tu, nothing else. Distance of movement is from your bed to the sitting room, kitchen. What?
You dress to go to the sitting room and all that. It's a journey on its own.
Yeah. Well, good to see you. Gerald, I want us to just look at what's happening. I'll look at the dailies, and we'll just begin with the Daily Nation today. Looking at the front page, we're seeing human trials for COVID-19 drugs set to start in Kenya. Well, it says here, as confirmed cases reach 419, local researchers participating in an international study are seeking final approvals from 2 agencies to test 3 drugs on Kenyans. I mean, Gerald, what do you think about this? Great developments? Good news?
I think, in a nutshell, the problem is that the politics that come around with testing of drugs, especially in countries, and we could look at it both ways. One of the ways is that what if actually this thing works out, then it means we stand the benefit of the treatment, of the benefit of the drug. But again, if it doesn't work out, then it backfires. If you can remember, in the past, we've had situations where children have been paralyzed because of vaccines that went wrong. So we could look at it both ways. We could be happy that maybe this thing works out, then the better we have the first advantage of a drug that we can have locally. If it doesn't work out, then we need to bear with the repercussions. And I think, as well, we need to, because right now we are seeing a lot of even resistance in animal testing. Even testing drugs on animals is almost becoming illegal these days. So we could look at it and say, okay, what are the risks that we stand? If you hear about the other time, there was a scandal in France when French doctors say that they were going to test the drugs on Kenya, vaccines, on corona vaccines on Kenya. And there was a lot of outrage.
Actually, Kenyans,
and all on social
they were
media,
not too happy to hear that.
International media and all that. So I think we could look at it two phases. Because also the president the other day in his brief said that he was not going to allow anybody to test drugs on Kenya. So I think, in my opinion, you can never run away from the fact that the drugs have to be tested at the end of the day. But the safety standard should come first. Okay. Yeah.
And just looking further into this story, it's on page 2 of the Daily Nation. Kenyan researchers have joined their international counterparts in the search for a cure for COVID-19, which plans for clinical trials for 3 drugs. Clinical trial is when medicine is tried on human beings to determine if it is effective in treating a disease. There was that concern, of course. People are talking on social media, talking about the fact that they want to make Africans, not just Kenyans, as though we are guinea pigs. I don't know if that's the case.
You see, the problem is I think we also struggle with an issue of inferiority complex, in the sense that every time something is floated to us, we have to fight it back. You know what's happening in Madagascar right now? They have mitishamba that are boiling in Madagascar, and actually it's working quite well. So we could argue and say we are not guinea pigs, but again, we need the drugs.
And even when this particular story here says the researchers are seeking approvals to conduct the trials to determine if a remdesivir, an antiretroviral drug that was recently approved by the United States Food and Drug Administration for emergency treatment of COVID-19, as well as anti-malaria drug, can be used, can become effective in terms of treating COVID-19. Of course, we've seen successful trials in the US, so I don't know if we'll see the same thing in Kenya. But let's just wait and see how that goes. Let's just look at page 3 of the Daily Nation. I think this is still on the story, on the new drug that's supposed to be tested. But let's just look at page 5. Calls intensified to boost cross-border surveillance. Well, the national government has been aided, rather, yes, asked to boost cross-border surveillance. I think this is a very good move because we need to know what's happening across counties and even just along our borders to know what's going on. Because if you're fighting COVID-19, we need to bring in more strict measures to make sure that there's no cross-border infections.
So the thing is, I would want to support what the government is saying. Before that, you had mentioned about the drugs. If we are saying we are not guinea pigs, we are talking about a drug that is being locally invented, you know. So we cannot take it outside and test it. We have to test it locally. So I think we don't have a choice. We have to allow ourselves to go through the process of testing. Like the other people in Mombasa are saying they don't want to be tested for coronavirus. So I think we need to agree that at the end of the day, this thing has to be tested and we need to use it. Now on the borders, there's a greater danger in us allowing the borders to be as porous as it is. In Migori the other day, we had 2 cases of coronavirus, probably imported from Tanzania. And you've seen that Magufuli has not taken the coronavirus pandemic as seriously as Kenya and the other East African countries have done. So it do not make sense, and it would be logic for us to fight corona inside and still allow our borders to let in visitors from those countries without very strict supervision and testing. So I think the government is now making the right step in controlling the spread of coronavirus. If you look at this, the first time, before we got the first case, there was an uproar on allowing the 239 passengers from China. And the government downplayed it. And they said, we have all the equipment at the airport and we can be able to detect this virus. There's no way this virus can leave the country. Then the virus came in and we said we are in control, we can treat it. Today, we are talking about 30 cases per day, you know. Now we are looking at Tanzania that's really being so careless with the disease, and it's an immediate neighbor with very close business ties. In Eldoret last week, the other day actually, I was seeing a lot of trucks were coming in from Tanzania. So you can imagine what this means, especially for this country. So I think the government is taking the right decision in locking up the borders. It should not just monitor, lock up the borders. Lock up the borders.
So you think it's actually a good move? Well, you know, considering the fact that it's believed that many people are not observing social distancing, they're not using masks. So, well, perhaps it also has, you know, a bit of a point there, because I don't know what someone in Bungoma is doing. They come to Nairobi or whatever the case. I don't know what is happening outside there. I don't know how they're taking care of themselves. But, well, as much as we're talking about cross-border movement, I think it's also upon the respective, you know, MCAs, MPs, governors, to make sure that people are actually adhering to the containment measures, Gerald. You know,
the biggest problem with this thing is that you can never tell who is infected and who is not. And you can never really get to know who is from where. This morning I'm here, I've met you, but you don't know where I was yesterday, you know. So it means that the risk factor keeps escalating, you know, as much as we are not very critical about how we move around. So when you talk about the social distancing, well, it makes sense. It does not make sense when we still have our borders open, especially with neighbors who are allowing other people to come in, you know, from other countries. And also the other countries which are not taking this thing very serious. If you see the way Museveni have really acted on this thing, Museveni has been very serious with this thing, by the way. And I'm telling you, Museveni is flattening the curve, seriously. And if all the other East African countries are not going to follow suit, then it means we'll continue having recurrent infections. Because you talk about dealing with the problem in Kenya, but you still allow truck drivers to come in from Tanzania. You still allow passengers to come in from Tanzania in a country where they believe that actually prayers cure coronavirus. I would be interested
to know, Gerald, if then we impose cross-border restrictions, what happens to business? What happens to trading?
But the thing is, you'll agree with me that business already is on a standstill. So it does not make sense to back it, to say we are locking down and ensuring that people don't move around and infect each other. But again, we are allowing some other people to bring in the disease. I mean, it beats all the common sense of management, you know. So I think in all ways, if you see what happened in Italy, is the more we continue to downplay, like Montai has been saying, if we treat this disease normally, it will treat us abnormally. So I think we are treating ourselves normally. As much as we are saying that we need to ensure that we are social distancing and all that, you can imagine that a truck driver from Tanzania, who has done several kilometers within Tanzania, comes in and has a chain of interactions all the way from the border. You know, probably he'll go and also and sleep somewhere. It's a whole chain of a problem. So we can argue that what will happen to the businesses, but the question is our businesses are already suffering. There's no way we can talk about favoring businesses from Tanzania against keeping our people safe. So we need to make a decision. If we are fighting coronavirus, then we must implement all the tough measures that we need to. And if we want to talk about opening up businesses, then we need to agree and open up the businesses. We cannot have it two-way. We cannot have our cake and, we cannot eat our cake and have it.
And even as we talk about business, there's a story here on page 9 of the Daily, says heads to roll as change looms in sugar sector. The story here just basically talking about major changes that are expected in the sugar sector as the Ministry of Agriculture moves to reorganize the sugar directorate. What is happening there, Gerald?
I think the sugar industry is an industry that has been ignored for the longest time. And if you can remember back in the 90s, late 90s and mid-90s, the sugar industry was a thing. You can remember Mumias that time. The Mumias brand was very prestigious. If you go into a supermarket and you buy Mumias sugar, you feel like you've purchased something you can be proud of. But over time, we've continued to kill the industry in all ways. First of all, by not financing it. Secondly, by allowing a lot of imports to come in. And thirdly, by ensuring that the farmers are frustrated and are not paid. The cases that we have to talk about in sugar industries are quite major. And I can tell you this from a point of experience because I've had the privilege to have a relationship with some of the people working in the sugar industry, especially Chemelil. If you go to Chemelil today, those guys have gone without salaries for a year, So if the measures we're talking about, and these stories of heads rolling in sugar industry has been talked about for many years.
And this particular
I think the only way we can talk about heads rolling in the sugar industry, stop the imports.
Yeah, because even here the story just goes ahead to talk about these changes are coming days after a group of stakeholders raised concern over alleged dumping of illegal imports from neighboring Uganda.
So I'll tell you, the biggest problem that we have in this country is not that we don't have resources, it's policy making. Because there's no way you can talk about importing sugar in a country that can manufacture enough sugar within to serve its own citizenry. So I think there's a lot of hypocrisy in the way government has handled the sugar industry. You cannot talk about empowering an industry without investing money in it and also ensure that you empower the policy framework. You cannot allow sugar to come in at maybe probably 100 shillings a kg and you expect to compete with someone who is manufacturing the same sugar at 120 shillings in this country. So I think there has been all the deliberate steps to kill the sugar industry in this country, not to empower it. Because over time, you're talking about imports and more imports and more imports. You're not talking, in fact, even the countries, the factories that are packaging sugar are not packaging locally manufactured sugar. They're importing sugar and repackaging it in local packages and saying maybe they're manufactured in Western Kenya, manufactured in Nyanza, Kenya, manufactured in wherever it is that we have sugar belts. So the government needs to move from all this hypocrisy and threats of heads rolling into policy. Let's talk about policy. Let's talk about policy on imports. We can say we are going to import maybe around 15% of the total sugar consumption. In this
I'm
country.
even wondering, Gerald, why import it then repackage it? I mean, I find it very funny because why then not get the sugar from our very own farmers?
The reason is, Leah, if you're into manufacturing, you'll understand that there's a cost of production and the overheads. So when you look at the cost of producing sugar locally, it's higher than the cost of repackaging imported sugar. So you look at it this way, if I'm going to produce a kg at 90 shillings, I need to run my overheads, I need to run my profits. If I'm going to import the same sugar at 60 shillings, what would you go for? I'd rather import and repackage. I mean...
So what does that mean for our Kenyan farmers?
What it means is simply the fact that the Kenyan farmers will remain poor. And that is why you're seeing the government is having a push and pull with the private sector. The private sector having this preferential way of working with farmers, like we need to do zoning. But the private sector does not want the zoning because they want to far reach to Western Kenya to bring sugar cane. They want to run to Nyanza to bring sugar cane. But the government is running zoning, but the factories that are being operated by government are dead. So you cannot impose a rule on an industry that you've not empowered. You cannot talk about zoning farmers in a place where you are not paying them. Farmers are owed millions and billions of money by government. So the government needs to get serious. First of all, before all the policies we need to talk about, we need to ensure that we are paying the farmers, number one. Number two, the factories are running. Chemelil is dead as we speak. Nzoia sugar is scrap metal. If you talk about the employees in the sugar industry, you look at the population that's very frustrated and the population that's really exploited by the private sector. So the government needs to swing in and empower the sugar sector, by investing money and ensuring that the farmers are also paid. Otherwise, all these shenanigans and heads rolling and all that, we'll keep talking about it for the next 10 years.
Well, Gerald, let's just look at the People Daily and just see what's happening there today. On the front page, Ruto allies now face the sack in Parliament. Well, the caption here says majority leaders Duale and Murkomen among Deputy President supporters targeted in patch from influential House committees as battle for control of ruling Jubilee Party escalates, but leaders promise to put a strong fight. A lot is happening within Jubilee Party. What do you think the future portends for Jubilee, especially with the wrangles, the wars? It seems like there's a lot of factions.
Actually, it's not only Jubilee. The other day, yesterday, I saw also ODM are beginning to fight. So I think there's an outbreak of fights within parties in Kenya. Look at the case scenario for Jubilee. I think there are things that I look at times, I think it's a bit laughable, because when you talk about the office of majority leaders, these are offices that are protected by the parties. And if you look at the people who are funding the conflicts in Jubilee, are people from outside. Most of these guys who are driving the conversations around Jubilee, most of them are either from outside or actually employees of the party. Tuju does not have any control in Parliament. When you talk about majority leader positions, and I'll tell you this, it's very clear. If you look at the standing orders number 19, that is number 19 clause 7, it's very clear on the procedure of firing a majority leader. You know, let's look at least for, you know, for instance at the Senate, and we look at the standing orders at the Senate. Standing order number 19(7) gives a clear procedure on how to fire a majority leader. And you look at the origin of a majority leader is a proposal from a party. And actually the people who vote are the members of a party, let's assume Jubilee Party. So you look at Murkomen. Murkomen has been proposed by Jubilee Party. And the people who ran a vote to ensure, to make him the majority leader are the members of Jubilee Party. If today you want to fire Murkomen, the party has to go and sit down and have a meeting. And the person who will chair this meeting is a chief whip. Chief whip is Nakuru Senator Susan Kiega, in that sense. So if Jubilee has the intentions of firing Murkomen, then Jubilee Party, not ODM Party, not Wiper Party, not Ford Kenya Party, Jubilee Party members will have to go and have a meeting chaired by the chief whip, who is Nakuru Senator Susan Kiega, and they'll write a letter to the speaker, that is Losaka, the Speaker of the Senate, that we have the intentions of changing our majority leader. But again, if you look at the possibilities of having this happening, is actually out of sight, you know, because Susan Kiega is pro DP for the records, Murkomen is pro DP for the records, and again, if you're going to subject them to a vote, it will still come the same vote that it was last time. So it's a question of numbers. And if you look at the Senate and the National Assembly...
Gerald, yeah. I would be interested to know, I mean, what does the future look like for anyone allied to the Deputy President and the Deputy President himself? Because he's going through a lot at this moment. Looking at what is happening, even this story in the papers, it just tells you that he's going to have a very difficult time in the coming days.
Anyone who has worked with the Deputy President will tell you that he's not one of those guys that you want to write off. And the reason why every other person is ganging up against the DP tells you a lot about what kind of a person he is. And all the schemes right now...
And what kind of a person is he in your view?
I've worked with him, I'll tell you that he's not one of those people that you'd want to run, you'd want to write off. And even every other person knows that. If you look at the whole country right now, we are fighting William Ruto more than we are fighting coronavirus, you know. So I think all the schemes are bound to fail. Number one, the only thing they can do actually in both the Senate and the National Assembly is probably change the committee members. That's the max they can go. Because committee members, it's across board in terms of voting. And don't assume that the people who are in ODM are actually pro-handshake. There are a lot of members of parliament who are against the handshake. And case scenario is just what happened yesterday in ODM. It tells you that there's a faction in ODM as much as there's a faction in Jubilee. You know? So you cannot actually assume that the members of opposition are going to side with government in terms of punishing the DP and all that. So when you talk about the schemes that are happening in parliament, I can assure you this, it's like the impeachment that we are talking about for the last 2 years. It's never going to happen. Changing the majority leaders is going to be a costly affair in terms of those people who want to push that agenda. When you talk about the future of the DP, I'll tell you, that guy has not even unleashed one of his cards. Not even a single one. But all these other guys have unleashed all the cards.
You are his supporter, Gerald.
No, I'm just speaking from a point of experience and as a politician as well, because when you're in politics, you'll understand how different people operate. you know. So I think I'll tell you this, that we could say the DP's future looks bleak, but you need to remember that as he even unleashed one card, he hasn't. And about the changes in the Senate and in Parliament, it's only a matter of time.
Well, let's just move away from politics. I want us to look at COVID-19. Story here in page 6 is in the People Daily says, don't fear mass testing, ministry tells Kenyans. Of course, the government is trying to call on Kenyans to come out, especially in the targeted areas that have been targeted for mass testing. Many people are not so willing to come out, Gerald, to get tested. Yet testing is very important at this moment, considering there's also the cases of people who don't show the symptoms, but they're positive.
You see, the biggest problem that has happened in this country is that we've made coronavirus into something like a punishment. That's how we've structured it. And as though you're talking about people who are being forced into quarantine. You know, we're talking about people who are being slapped with bills up to $500,000. I was having a case in Mombasa last week of a family that had been slapped with a bill of 475,000 shillings. So if we intend to actually, the only way we can talk about ensuring that citizens accept to be tested is the consequences. Because a citizen is saying, okay, I'll be tested. Then after being tested, what next? You know, you're being taken on forced quarantine. You're going to be slapped with a bill of 200,000 Kenyan shillings. It's a crazy thing. And even me, if I was actually asked to volunteer to go and test, I would not go and test.
And it seems like the government is grappling with a lot more than perhaps what it can handle, because here is Kenyans. Some of them don't want to get tested. Yesterday I was talking to some analysts in the morning, and they were talking about the mistrust between government and citizens. But even more than that, you look at page 12 of the People Daily, talks about counties being ill-prepared in corona fight. I mean, seriously, Gerald, why are we never prepared? Because these are things that the government needs to have already put in place. Preparedness. We talk about floods, preparedness. Now we're talking about COVID-19. Of course, something that has never happened before, but the preparedness is still in question, the government's preparedness.
I think as a country, everything gets us by a surprise. Every single thing. Even
no, it doesn't really have to be that way.
Even the things that happen every day, like the floods in West Pokot, it happened last year. You remember that? It happened last year, and we had the same disastrous results last year. And the government has not made a move to ensure that it puts in place disaster management strategies. And when we talk about disaster management strategies, it's not one of those things that you pull off from the cupboard. It is things that needs to be there every other time as a management strategy. When you look at coronavirus, for instance, other countries have handled it so well. Other countries have ensured that the citizens are treated for free, the tests are run for free. You're hearing a government that is charging its own citizens even for isolation. You know, isolation, your child money to be isolated by a country that pretends or actually wants to make us feel that it's fighting the virus. So when you talk about the disasters that you're talking about, is the issue of the unpreparedness of this nation runs down in policy making. There's no policy, there's no law around disaster management strategies. There's no law about keeping something, you know, for those cold days, for those rainy days. So every other time we have to run into, that's why you're even talking about the double taxation.
Like a last-minute move.
Yes. So you talk about double taxation to raise funds for coronavirus. You're talking about fundraisings for coronavirus. It tells you of a country that's not prepared at any single time. Like you, Alea, you'll be surprised when your children open school. You know, you're like, oh, kumbe shule zimefunguliwa. Utatoa wapi fees? Ama mtakula nini?
Of course you're prepared, Gerald.
Yeah, so the government is not prepared. That's what I'll tell you.
And considering this COVID-19 is in over 20 counties in the country, well, a very sad state of affairs. Gerald, I just want us to take a short break, and when we return, we'll be looking at news, what's happening in the country, and of course across the globe and the region as well. So remember, Morning Cafe does take a short break, but indeed we'll be back shortly. Remember, you can engage us through our social media platforms, that is TV47KE on Instagram, Twitter, and Facebook. Remember, you can tell us where you're writing from. Tell us, of course, also what's happening where you are. And of course, if you are in traffic, in case you are in traffic, tell us what's happening where you are. We'll be sure to sample your comments and your views. So Morning Cafe takes a short break, but we'll be back shortly. Stay tuned. Hello there. Welcome back to the Morning Cafe. Sorry for taking a little bit of a long break. We're trying to fix something there, a bit of a technical hitch there. We do apologize for that. However, let's just take a look at some of the stories that are making headlines in the country and, of course, globally and regionally. Let's begin with the rapid spread of COVID-19 has been associated majorly with the disobedience of Kenyans who have failed to adhere to the Ministry of Health directives. Now, giving a daily update on coronavirus on Monday, Health CAS Masi Mwangangi warned vendors who allow mask buyers to touch more than one item. Take a look.
It was also noted that there are vendors who continue to allow people to fit more than one mask when buying. This is a dangerous practice, and this can lead to mass infection.
25 more Kenyans have tested positive for coronavirus, bringing the total of cases in Kenya to 490. This is after testing 1,012 samples in the last 24 hours.
Out of this number, 25 people tested positive for coronavirus. And out of these cases, 15 are from Nairobi, whereas 10 are from Mombasa. All the 25 cases are Kenyans, and none of them has a history of travel. In terms of gender, 13 are males and 12 are female. The age distribution of the new cases ranges from 6 months to the youngest to 60 to the oldest.
Among the areas that recorded the 25 cases of COVID-19 in Nairobi include Eastleigh with 8 cases, Kawangware and Umoja 2 cases each, Mathare, Kahawa West and Kariobangi recorded 1 case each. In Mombasa County, Old Town recorded 8 cases, Bombolulu and Jomvu had 1 case each. Dr. Mwangangi has emphasized on the need to follow the government directives since it's an individual responsibility to curb the spread of the deadly virus.
And to remind you, 1, we must observe social distancing. 2, we must continue to wash our hands frequently. 3, we do call on you to stay at home and only go out when it's absolutely necessary. And whenever you're out in public, one must wear the face mask.
Globally, more than 3.5 million people have tested positive for COVID-19 with over 248,000 deaths. Joash Onsare, TV47 Nairobi.
And well, a section of Nairobi County MCAs are reviving talks of impeaching Nairobi Governor Mike Sonko after he indicated his intention of terminating the deed of transfer of key county functions to national government, citing frustrations by unnamed individuals in the office of the president. But as Linda Alele reports, the move is a divided one, as Jubilee MCAs say they have not received a word about it.
What was seen as a rescue mission for Nairobi has turned out to be a bitter pill for the king of rescuers to swallow. Nairobi Governor Mike Mbuvi Sonko. The few who know how to study body language would tell you that his audacity masks his desperation. His political journey is set for more hiccups as a section of MCAs have revived talks of removing him from office.
By and by, I think the MCAs of Nairobi were very ready. If that Tuesday could have come, Nairobians could have really known that there are leaders in Nairobi who are elected across the political parties. Because we saw, as MCAs, there is a problem. And we dissected the problem and we got the medic that we wanted to inject in this problem. And we are ready. And even now, I believe the MCAs are still ready. If given a go-ahead to give the injection what is out of Nairobi, they can give this injection.
Hiyo issue imerais sababu ya change of leadership. Ndio wameona ametolewa inarudishiwa Nguyo. So wameanza na yeye kusema impeachment lazima irudi wakiwa na wale wenzake wa NASA kadhaa.
In an unprecedented move in February, Nairobi Governor Mike Sonko surrendered key county functions to the national government in the wake of corruption charges leveled against him. A move he later termed as coercion.
And Sonko has kept on defining himself what incompetence is. When a full governor governing 5 million Kenyans can say he signed a document without reading it, really, that's a fair example of saying you're incompetent enough. Just reading a document that commits the lives of 5 million Kenyans somewhere is one of the worst incompetence you can be. So I won't say that the government's on the other side. Sonko has already been on his own side. Sonko has never taken anybody serious in terms of making service to the people.
as he wrestles the transferred functions back from the national government, accusing senior officials in the office of the president of frustrating him. His defiantness seems to fall on deaf ears as the president continues to tighten his grip on the Nairobi Metropolitan Services.
Need to read again Article 187 2B of the Constitution. And it expressly says that the responsibility, the constitutional responsibility of any of the functions that are transferred from one government to the other shall remain with the government that transferred them.
The renewed calls for a fresh ouster comes at a time when the governor is at loggerheads with the Nairobi Metropolitan Services over functions transferred to Mohamed Badi's office. A scenario that experts argue lays the ground open for the MCA's impeachment efforts to sail through. Jubilee Party MCAs have, however, disputed the above allegations, arguing that no official communication has been given to override the options given to them by President Kenyatta months ago when talks of an impeachment of the governor were rife.
That deed, I've seen that deed, it's so binding that it must be on mutual consent between him and the president for one to walk out of that deed. It is time. However, he is on the songs of lamentation like any other person because he's getting the frustrations.
Roysambo MCA Peter Warutere, who is also the chair of Health Committee in the County Assembly, and his counterpart MCA Anthony Gatune of Kahawa West, say no official plans have been set to revive the impeachment process.
There's a big relationship between the president and the governor, Mike Sonko. Had it not been for that, then he could have gone it away. It would have been easy. We would have been glad maybe for us to even send him out, to send him home. That won't happen.
Hakuna mpango kama hiyo, watu ni speculations na kuongea, lakini ile wakati tutaitwa kikao tutaanza kujua the way forward.
Question is, what will it take to impeach Sonko? Will the motion against him see the light of day, or the previously speculated exchange of political handouts and political sanitization will play out again?
For people to impeach a governor, 122 of us, we need a threshold of three quarters of 122. That is 92 members. Must, Assad, that is 42, must sign the impeachment motion, and for that particular day, that house must have 2/3, which is about 82 members. In Jubilee, we are 66. The other coalition has 56, I bet, yes, to make it 122. Governor has people from both sides, I can tell you for sure. For people to raise the signatures, 55 even, to impeach Governor Sonko, unless that directive is already coming from one person. And that person is the president of this public. It would be like cutting Maumbo tree to impeach the governor of Nairobi. That is not.
Office of the Governor, Nairobi City County, indeed an office that is haphazardly occupied by the Governor himself, embattled Nairobi Governor Mike Sonko. A question of wait and see of what its fate is going to be as talks of an impeachment are rife. Battles against him and the national government have put the people of Nairobi in limbo. But for how long is a question of wait and see. Reporting for TV47, Linda Alela.
Well, moving on, 5 health workers' unions have threatened to go on strike in 2 weeks if the government does not address their grievances fast. They lament of a lack of adequate education on COVID-19 as well as lack of personal protective gear, among other grievances.
Comrades, power! Power! Comrades, power! Power!
Those words are enough proof that these leaders of 5 unions of health workers are ready to fight for their rights. According to the national chairman of Kenya Union of Clinical Officers, Peterson Washira, they have been presenting their complaints but in vain.
When the unions raise issues, it is the expectation that when the leadership of the employees talk, that the government must come to the table and listen to them. Because they are the people who are on the ground, who know where the shoe pinches.
Some of the issues they've been presenting are lack of enough education and personal protective equipment to help them protect themselves from the deadly coronavirus, denial of access to the city center from the neighboring counties, and not being involved in the coronavirus emergency committee, among others.
Ingine ni ile mikataba ambayo wameweza kuleta ambayo inakiuka sheria zile zilizopo. Hizi mikataba tumesema lazima zifutiliwe mbali. Kwa wakati huu ambapo ni hatari sana kwa kila mtu, wanaafya wanatumika kama kinga kukinga wananchi wote hapa Kenya na pia ulimwenguni kote. Na kwa sasa watu wanalipwa shilingi 15,000 kufanya kazi hii, chini ya vile ambavyo wamehitimu kufanya hiyo kazi. Tumesema ilani yetu ni kwamba hizi mikataba ambayo haikutani ama haikinzani, inakinzana na sheria, lazima ifutiliwe mbali, na ni lazima waweze kuwaweka kwa mikataba ama structures ya scheme of services zile zina exist.
Besides that, these leaders have called upon the Ministry of Health to take action on the officials in the Ministry of Health who have been involved in graft.
How can you transfer, redeploy people? You are saying they have misappropriated funds. They are supposed to remain in the ministry, investigate them. If they are found guilty, let them face the full force of the law. Your actions are very clear that you are out to cover up.
Following the memo released by the 5 unions of health workers, the chairman of Kenya Health Professional Society, Mohamed Duba, has said that a national strike by the health workers from the 5 unions will commence on the 18th of this month if the government does not look into their grievances.
This is in reference to a memorandum submitted to your office highlighting the issues mostly affecting healthcare workers, and which the union requested the government to address them with finality. It is disappointing to know that up to date, the government has remained adamant or choose to totally ignore our grievance, leaving the union and the association with no option but to take further action.
Lydia Gashomo, TV47.
And well, that very story takes us to a short break. Remember, this is the Morning Cafe, and you can engage us through our social media platforms. That is TV47KE on Instagram, Twitter, and Facebook. We also want to hear where you are, what's happening where you are, and in case you're in traffic, let us also know what's happening exactly where you are as far as traffic is concerned. Well, let's take a short break. Morning Cafe will be back shortly. Don't go too far. Keep it locked. Welcome back. This is the Morning Cafe right here on TV47. Again, my name is Leangare, and this is the segment where we get to look at stories making headlines locally, regionally, and of course internationally, just to see, of course, we have COVID-19, of course we have matters on border shutdowns and a lot more. But let me first introduce my guest in studio. We have Gerald Bitok, who is a political commentator. Gerald, you've been with us since the beginning of the show. And of course, we also have one guest who has joined us, the ever beautiful Agnes Ibarra, who is a policy and governance analyst. Agnes, how are you doing?
Thank you for having me, Leah.
Looking beautiful as usual. How is COVID taking you? Social distancing, nini?
Yeah, it's not really vizuri. We are following the government directives, and we are keeping fear at bay, and I think all will be well.
I never asked Gerald. Gerald, what are you doing? Other than, actually, Gerald mentioned earlier on, all he does is move from his bedroom, go to the sitting room, eat food, and go back. Okay, fine, Gerald. The ever handsome Gerald. Thank you very much. Gerald. Hey, Banapole, sir. Next time, just the ever handsome Gerald. Sawa basi. Well, I want us to begin by looking at one of the top stories there. We have the government ordering on border shutdowns. Of course, the whole idea here is to restrict movement and in a bid to also contain the spread of coronavirus. What do you think about what we're doing in terms of cross-border shutdowns for you, Agnes?
Thank you, Leah. And maybe I'll start off by saying that lockdowns and what we have maybe implemented in Kenya ourselves, the partial lockdown and the curfews, limiting movement from one county to the other, especially what the president said about concerning Nairobi, Kilifi, and Mombasa. You do realize that lockdowns are a security instrument, and not even that, they are also public safety health protocols. So, and I think the only two ways of beating corona at this moment is either through elimination and suppression. And partial lockdowns serve the purposes of suppression. And you realize that what we have done as Kenya, locking down the borders, has helped us to keep our numbers low and our deaths even lower.
And you know, earlier on when I was talking to Gerald about this issue, I think for me the greatest concern would be issues of trading, you know, issues of businesses that rely on cross-border movement. What happens to them, Agnes? What's your view on this?
You know, that's why I keep on saying and I keep on telling, like maybe in conversations, I keep on saying and referring to like total lockdown in Kenya being, the chances of it happening are slim to none, because you do realize that Kenya is a gateway to East Africa and it's a regional gateway. And if we lock down Kenya, it means that other countries around us and those who depend on our infrastructure and systems will not be getting vital goods and services. And I think that is the major reason why a full lockdown cannot happen in Kenya.
Okay, and if you really look at what the government right now is doing, boosting cross-border surveillance at its border points with Tanzania and Uganda, what does it mean for interactions between the two countries? I'll just ask, probably, Agnes, if you can just answer that question before we go to Gerald.
You see, Leah, there is need to really up the need for testing, especially when it comes to cross-border movements. And it's key among which is testing and having these centers on borders and all of our entry points. I think it is important to test everyone who's coming in, because we need to filter and really curtail chances of community transmissions. And we see right now Uganda is doing a partial lockdown and their cases are going higher. Tanzania, their cases are going higher. We have porous borders. We have about 5 entry points in Kenya. And so I think and I support the need to have tests on our borders.
I'll just ask Gerald that question again. Just looking at what Agnes is saying, Gerald, in terms of what the government is doing to put more surveillance across its borders, that's with Tanzania and Uganda. The question here would be the interaction between the two countries. Of course, we've seen, well, we'll talk about this later on, New Zealand has opened up the economy. And, you know, ASCA is here, we're now looking like we're about to start closing down our borders to restrict movement. I mean, what do you think about the impact this would have on the economy?
Like I said, Leah, I think we are losing a lot in terms of economy, and it would be very pretentious and hypocritic to, you know, to try and say that by us opening up the borders, we are empowering business, and by us closing, we are stopping, or you know, or we are actually negating the gains of economy. I think at this point we have to choose a war. We cannot fight two wars, the economic wars and the corona war. We have to choose to fight the corona war. Once we are done with the corona war, that's when we can now focus on economic recovery. So I think in all ways, if I was the president, this is something I should have done a long time ago, and this is something that other countries have done as well, as a measure to ensure that it stops and controls the imported infections. It will not make sense for us to claim to be fighting corona in the country and still leave our borders very porous. So I think I support the government directives to closing the border. But again, there's a question of essential services like food and all that. So I think what we need to do as well is to ensure that we have border controls in terms of medical and testing, health controls, and ensure that nobody who is infected or has all the symptoms of coronavirus gets into the country. Because I think if we are not serious about ensuring that we control our borders, then we could have this fight all the way to next year. So, like I said before, it's time we chose a fight, because if we choose to fight half corona and half economy, also cushioning the economy, then we might end up having this thing stretching all the way to next year. So if we make a decision, and this is what I've said, as much as we can say we cannot afford a lockdown, but I think progressively we've been experiencing all the symptoms and all the consequences of a lockdown. So we need to make a decision. You saw what Italy did. If Italy did not implement a complete lockdown, it would not have flattened the curve. Coming closer to Uganda, Museveni has been very serious about coronavirus, and he actually locked down the borders, with, except those essential services, and he also ensured that all the drivers who are coming into Uganda were tested. And again, he ensured that he had a lockdown. I think we're still having a lockdown running in Uganda. And if you look at the statistics of Uganda, the cases, the coronavirus cases are going down. So if we do the same in Kenya, then I'm really confident that we could have at least a graph that is going down. So I still support the border lockdowns. I actually propose a total lockdown if it's possible.
Well, I would like to hear from you guys. Do you think the traders are doing, because one thing that has been mentioned is that traders are not observing the containment measures, from social distancing, from wearing masks. What more needs to be done? Because controlling traders is very difficult. You can't be policing each and every one of them everywhere they are. Agnes, what do you think maybe the government needs to do in order to, restrict those, to impose maybe more measures in terms of making sure that traders are observing the containment measures?
I think for once it will be a bit unfair to maybe throw all and cast all of the guilt on and blame on the traders. Mm-hmm. You see, Leah, how our social structures are set up. We have our communal markets and our restaurants and our shops as tiny, constricted areas of operations, yes? But you see, the biggest thing that we can do right now is maybe continue sensitizations, aggressive campaigns, and communication to the traders. And maybe we have lessons to learn from Lithuania, a country that has decided to open up all of their restaurants and their market. They are looking at big spaces like stadiums and open and vast fields, and they are setting up restaurants and markets for their people so that they can have the adherence of social distance. But the challenges in Kenya is that the markets remain the same. The small vibandas, the small spaces, our mama mbogas share and are squeezed within a small space. And maybe one of the things we can do other than education and sensitization is look for spaces wide enough to accommodate social distancing and spread out our traders.
Okay, I just want us now to move on to something else. But even before we go too far from matters COVID, just going into New Zealand, I think there are a few things we can learn from New Zealand. The fact that New Zealand is opening up the economy partially. Look at this, children up to the age of 10 can actually go back to school. Ain't that good news? And then we also have gatherings of up to 10 people for weddings and funerals, apart from parties. And of course, the population seems to have supported this move. Gerald, what can we learn from New Zealand?
I think before I go to New Zealand, I want to give you an assignment, Leah, when you get time. Mm-hmm. Over the weekend, I had a drive all the way through Langara, through Karen, to Kajiado, through Kiserian, all the way to Ngong, and back to Kajiado. And you realize that when you mentioned about the traders and control, when you're going through the Rongai market, you realize that business is going on as usual. People are moving on with their life. When you go to Kiserian, actually, people are not even wearing masks. But the border riders are just, a few centimeters off each other without masks and all that. So I think we're still really far from sensitization. Like my friend said, is that I think we need more education, more civic education on the effects of corona, and actually to ensure that we push, because even some Kenyans are saying maybe hata hii corona kuna labda ni serikali wanakulia pesa. So we need to push this discussion further to ensure that every citizen is aware that this disease is actually real, and it is them only who can stop it. From there, I think we look at New Zealand. I was looking at the statistics in New Zealand, and you realize that this is one of the countries that we really have to use as a case study in terms of studying the trends around coronavirus. And it comes down to the strategies, Leah. Mm-hmm. There is no other way you can talk about fighting corona without strategies. It all boils down to the strategies that New Zealand had. And you cannot expect something from nothing. If you look at the strategies that you're putting as a country, we even talk about traders. In other countries, we've talked about subsidies that the government is giving up to 50% to businesses to ensure that the businesses stay afloat. If you leave people to their own means, then they have to define and they have to devise their ways to survive. And some of these ways at times might be against the law. So as much as we are talking about other countries that are flattening the curve in terms of fighting coronavirus, we need to look at their strategies and we need to look back and say, okay, when we look and compare the strategies that other countries are taking and what we are taking as a country, are there chances that we are actually going to fight this thing? The chance is almost nil. When you look at the trends that have been happening in Kenya, is that we are continuing to have a progressive trend in terms of cases that are continuing to go up. And again, the public behavior is continuing to deteriorate. In terms, even in informal sectors, you talk about Mombasa, even people coming out to press conference and saying, we are not going to allow ourselves to be locked down. So when we look at New Zealand, I think it will be very practical for us to look at the strategies as well that New Zealand took to where they are today. But I want to congratulate New Zealand because they have taken the interest of the country first at hand. And you know, you've talked about the public support of the citizens in New Zealand supporting the strategies the government is taking. We come down, but we realize that citizens in Kenya don't trust the government. They don't trust the government at all. They actually don't believe when there's corona. The other time I was having a conversation with some guys that are saying, and these are people.
But why do you think this is the case? Yeah. Because for some Kenyans, it actually looks like they still don't believe that COVID-19 exists. Is this because maybe people are not seeing the actual, okay, fine, we get numbers every day, but we never get to see the faces behind the numbers. Agnes, what do you think? Is this the case because they're not able to put a human face to the numbers, then they think maybe they're just figures being given by the government?
Leah, maybe I'll go back to what we can learn from New Zealand. And I think several factors helped New Zealand deal with corona. And one would be the fact that New Zealand is an island state, so they were better able to control their borders. And the second was that the frontline workers and the health workers were separated from their families. When they were dealing with the cure, when their cases started going up, the doctors and the frontline medics were separated. They never went back to their families. And I think we can also laud the quick action of the Premier, Jacinta, of acting very fast. From their first case on March 23rd, she announced a lockdown on 25th when there was just one death, one corona-associated death. But the fourth thing that maybe you are talking about is social responsibility. The Kiwis are known globally to have a strong sense of social responsibilities, and they follow protocols that have been laid down by government. But you see, I think Kenyans are not, it's not that they have a defiant spirit, but we have a laxity, a form of laxity that makes us not take issues seriously. You see what Bitok has mentioned, people in Kiserian life is going on normally. We've seen even clips. In Kangware, yes, we've seen clips on TV of people wearing masks but pushing them down their mouths, talking and arguing. And you know, we have already been told that this thing is in the saliva, in sputter, in cough, when you do and you sneeze, you know. So I think it isn't defiance but laxity, and this can only be cured by sensitization and education. But I still think there's a sense of defiance. Look at the curfew orders. Some are still going against the curfew orders, and it's really not clear why Kenyans behave this way, the laxity. When we see there's a crisis in the country, the way we respond to the crisis, it just leaves a lot to be desired, Gerald.
I will not call it defiance. I want to look at it in a different way, and I'll say that Kenyans are people who are between a rock and a very hard place. Between a government you cannot trust, and between a life that's too difficult to, you know, to persevere. And you look at it and you say, these people have to make a choice at the end of the day. And the argument is, people are saying, even if corona does not kill me, then hunger will kill me. Corona, I don't see it. People are saying, corona is there, I have not seen it physically, but hunger, I can feel it. My children, when they don't have anything to eat, I can see the pain in their eyes. You saw the case in Mombasa where a woman was boiling stones. It speaks a lot about a government that is spending billions of money in the wrong places. You heard about government officers consuming tea and mandazi worth 10 million Kenyan shillings. And you cannot claim to force responsibility upon Kenyans by a government that has failed to be responsible in the first place. So I think, Leah and my friend here, it makes more sense to look at the structures that surround the Kenyans and the situations they are in. And what they do is an act of rebellion.
And
you know?
I'll tell you, just moving away from COVID, even as you talk about how the government is spending the taxpayers' money, the priorities that they have, some of them don't even really make sense because there's more pressing issues, especially where the lives of Kenyans are at risk. Looking at the locust damage assessment set to start very soon, perhaps in a month's time, you look at the fact that the government has spent 500 million shillings to purchase chemicals for, aerial spraying. We now have COVID. Again, now we have the aerial spraying. We have now the locust invasion that is not away from us. It's still with us. I mean, the preparedness of the country, that's my first question, Agnes. What do you think of the government's preparedness? We've talked about this so many times. So what's the way forward?
Leah, we had our first invasion, locust invasion. Now it's being dubbed the locust invasion in December. And the projections are that we are going to have another swarm in about mid-June. But about preparedness, when I heard the PS talk about the level of preparedness that Kenya has, he mentioned that they have purchased the chemicals and they are right now doing aerial spraying. And he mentioned maybe some difficulties and challenges that they are undergoing. The rains, and the rains make it impossible for aerial fumigation and the use of those chemicals. But he also insisted that the government is ready and prepared to fight the locusts after, for a period of 3 months. Leah, about the assessment, my issue here would be, I would ask, is it necessary now? If there are already projections
that's a
by
question
FAO.
I'm asking myself, Agnes. Is it necessary at this moment? Shouldn't we be thinking more about saving lives and maybe we put all effort there?
No, there's already budget allocations, and we have our development partners. We have FAO and we have Egerton University that have already been pegged into the program. I don't think there's an issue of diversion of funds that can otherwise be used for COVID response. But my issue here is, if we are going to have another swarm and another invasion in mid-June, why do it now? Can we wait? I know it's important to have and to maybe assess the locust damage, because right now Kenya will be dealing with a lot of food insecurity issues, especially post-COVID. But I think, and I know, and maybe in the government perspective, it would be wiser to wait until the second swarm comes, and it has been projected that it's going to come in June. So for now, I don't think it's necessary, but the projections of 1 month from now, maybe they're seeking to wait until the second invasion.
Gerald, your thoughts about the assessment?
I think, first of all, there's one thing phenomenal about Kenyans and the Kenyan government is that we forget so easily. Around 2 months ago, we are all abuzz about locusts and all that. We're like, oh, locust here, locust there. Today, nobody's talking about the locust. And actually, last week, I was having a conversation with one acre fund. And actually, the second invasion we're talking about will even be crazier than the first invasion. As we're speaking right now, in the northern area, northeastern, running into Somalia and Ethiopia, locusts are breeding like nobody's business. And we can only pray that the wind does not sweep this way. Because right now in Rift Valley, which is the food basket of this country, is when we just planted and the maize maybe just germinated. I mean, they are leafy. So you can imagine what would happen if we have the second invasion and the winds blow all the way to Western Kenya. We are lucky last time the first invasion is because we were not planted at that time, so we could not really experience a lot of destruction. But again, comes and begs the question of government strategy. You're talking about assessing damage, and when you're actually expecting another invasion. So for me, it's a flip-flop kind of dealing with it, and it comes back to our strategies in terms of managing disasters. And Leah, it's quite laughable that the government is expecting a second invasion, and instead of thinking of how to stop it, they are thinking about how to assess the first damage. What I'll look and what I'll talk about is, if the government is very serious, then it should invest the resources they want to run on assessment and ensure that it invests in fixing the problem that's coming on the second time. How do you fix it? Why don't you ensure that you deal with the locusts at the breeding ground? Why do you have to wait for locusts in Western Kenya? Wait for locusts in Rift Valley. Wait for locusts in Nyanza, for them to come so that you can deal with them. Munya has the capacity, like he has made us believe that he has the capacity to deal with locusts. Why can't he deal with the locusts in the breeding areas in Northeastern? You can remember last time Munya told us that the locusts were now grown up, they're not going to eat much, they're growing old, they're about to retire. We're also talking about the
But
environment
actually, on the
happening.
contrary, the Food and Agriculture Organization is actually warning and saying that the swamp seems to be forming and maturing. So that
That's
means
what I'm
they're
saying.
not going
That's
anywhere.
what I'm saying. I've been following on this thing, and One Acre Fund has a very fantastic report. And if Kenya was serious, by the way, there are non-governmental organizations that are running in Kenya that have the data and they have the strategies on how to deal with this thing. If I was Munya, for instance, what I could be doing right now is, how do I deal with these locusts at the point of breeding? You cannot have a discussion of waiting for locusts to grow up. Then they say, now locusts have grown up, they are coming to Western Kenya. When you can deal with them at the breeding ground. Then when they're in the Western Kenya towards Rift Valley, we'll now talk about locusts that are about to retire, when they have destroyed all the plantations. So I think, Leah, common sense has evaded the Ministry of Agriculture in all ways. You talked about the other time, we were talking about the maize strategy. Last year, Ministry of Agriculture didn't buy even 1 kilo of maize from farmers. And right now, Munya declared, actually last week, that the country does not have maize and they want to import 4 million bags. It tells you a lot about the government strategies on how we deal with things. We are sitting here and saying, now the locusts are in northern Kenya, they are breeding, we are waiting for them so that we can deal with them, we have chemicals. So I think we are wrong in every way, and the government and common sense are like water and oil.
Let me tell you, and the government has a lot more to deal with. Now we have health workers who have issued a nurses' strike. Can you imagine? At this moment where we have a health issue in the country, in this case the COVID-19, nurses are now threatening to go on strike. And this is 17 cadres of health professionals demanding better workplace protections in the wake of coronavirus. I mean, how much more can the government deal with? Agnes, we have a lot we're dealing with in the country.
Yes, for sure. And it's very heartbreaking to actually learn that about 5 unions of health workers are threatening to put down their tools. I think, I don't think there's anything that can be more catastrophic. But I think, in my opinion, Leah, I would really suggest that at this moment, we just need the national and country authorities to just meet and make sure that labor issues do not, what can I say, curtail the response of COVID-19. But on the same note, I do believe that health workers right now should exercise a high level of reason and stop blackmailing and twisting the government.
It seems like taking advantage of the situation.
Yes,
and it's not a good situation, by the way.
It is sad that they're choosing this time, and I think maybe they can shelve their issues, even if they're talking about risk allowances and maybe lack of training of preparedness of COVID. But I know that a lot is being done by the Ministry of Health to train our frontline workers, and they should right now, their union leaders, the KMPDU, the Nursing Council, the Clinical Officers Council, they should exercise reason and talk to their members to really postpone this. And you know, Leah, these are the medics who have taken Hippocratic oaths. They have taken oaths to make sure that they have the importance of life. Yes, the importance of life comes and surpasses everything that they do. So I don't think financial gains should make them really want to put aside the sanctity of life.
And Gerald, the issue here, they're demanding for harmonization of risk allowances to 30,000 shillings across all cadres. Well, currently they are said to be getting just about 20,000 shillings, and others are getting 3,000 shillings. Is this sufficient for them?
I think I'll beg to disagree with both of you again, and I think it's time we stopped referring to issues and concerns raised by the health workers as blackmail and noises, you know, because it's time we prioritized healthcare. If there's a time that we need to relook at our strategies in terms of healthcare, is now. And you cannot, and I think the government is quite ridiculous. The other day, the president was sending flowers to the UK, while our own doctors here have, you know, the kind of messages I receive every day on my Facebook page are quite ridiculous, and I wish I could share some of them with you. Frontline healthcare workers are talking about using even their own monies to go to work and back without a salary. I mean, it's crazy. And these are people you expect to fight on the front line. And I think, like I say, the government is quite ridiculous in how it prioritizes its expenses. Usually, look around my helicopter when they are moving around with banners of God bless the medics. How can you talk about God blessing the medics who don't have anything to take their children in the evening? And these are people who are risking their lives. So I think they are all justified in the way they are coming out. And that is only language Kenyan government understands from history. And when you talk about...
the question, Gerald, is this, and I think that's what Agnes mentioned,
Yes.
I just want to understand from both your views. Agnes's position is this really the right time to be doing this, to be calling for a strike at this moment?
Let me ask you, Leah, when is the right time to stay safe? Because these are people who are talking about PPEs.
Because without the health workers, then who will take care of the patients?
Leah, we are talking about the PPEs. PPEs are personal preventive equipment that are preventing them from contracting coronavirus. You cannot postpone safety. You cannot talk about postponing safety to another day. These people are saying we want the PPEs to protect ourselves. The issues of allowances in a discussion maybe you can talk about having later. But issues to do with personal protective equipment is something that the government must prioritize. And I think this is how we have it wrong, because you can imagine, Leah, if you're waking up every day to go in contact with people who have a deadly disease every morning, and you don't have the preventive equipment, in a government that is talking about investing in fighting the virus, and you're talking about money that is being spent in all the wrong things. So we can argue about the allowances. That's something we can have a discussion and say this is not the right time to talk about the allowances. But Leah, when is the right time to talk about personal protective equipment? When is the right time to talk about the medical practitioners being safe? I mean, we need to be fair as well. You cannot expect these people to wake up every day, to go and expose themselves and clap going home. They are going home to families that they love. They are going home to people that they love. Even these people have ambitions as well. So I think we can argue about allowances, but I would not want us to argue about the personal preventive equipment that they're asking for.
Fair enough.
Yeah.
Well, I just want us to move away from that and just look at, on a lighter note, churches. People are not able to gather in churches, and now we have gone all the way online. But it appears that churches are not making as much money in terms of tithes and offerings. They're unable to kick off. What do you foresee for churches in the future, Agnes, looking at what's happening right now in terms of sustainability and financial sustainability in this case?
I think for me, one of the best things that have happened to the world and to Kenya especially is Corona being the sieve that we needed to separate prosperity churches and those ones that sell ideas and ideologies and personalities, and serious, well-established churches. There you realize that the well-established churches are not struggling to be online. The Catholic Church is broadcasting their services every Sunday. They are booking slots on TV channels and prime time. We have the major established churches in the Pentecostal faith. They are also broadcasting their services. And I think this is the future for churches. And we have to step aside.
But is it a sustainable future? Because some of the churches are reporting. I think it cuts across. Most of them are affected, of course, because I think it's also the discipline of the churchgoers to give their tithes and offerings. And we know that churches are only sustained by tithes and offerings. So what happens?
I think it depends on how you look at it. Is a church a place of making money or a church of shepherding God's people? So for me, I don't think it matters whether you lose revenue or not. But are you ministering to the people? And can you minister through the TV? Most of the time, with my busy schedule, I end up watching masses and services on Monday or Sunday and in the evening. So I think this is the way the churches should be going, and it is a sieve that we needed. You see, many are limping away. We no longer hear about churches that, sorry to say this, of the Kanyaris and the rest, and we are talking only about established churches that have a footing in Kenya.
So now we are able to tell that, okay, anyway, I don't even want to comment so much on that.
Yes, I know, it's a sensitive topic, but...
I don't want to say so much.
Yeah, it's a sensitive topic, but... Yes, thank you, Corona, for seeding it for us, yeah.
I'll say that it's a very tough time for businesses, and church is one of those businesses. I mean, we need to be alive to the reality that the church...
Okay, Gerald is calling church a business.
It is a business. I mean, whichever way you want to look at it, Leah. And I think when you're talking about subsidizing businesses, we need to consider the churches, because it's crazy.
They're already subsidized. These guys don't pay tax.
These guys are entrepreneurs, I'm telling you.
But they don't pay tax. They're already subsidized.
So it's a tough time for entrepreneurs, including the pastors in churches. And you can see, you can actually feel the mood. I was seeing, I don't want to mention the name, but if you watch the videos, he saw some other bishop who was in some wilderness the other day, and he was very upset.
Yeah, it's all
right. So I think it's a tough time, and these guys have put out the baby numbers out there, and these people are not sending money, but you don't have money. So I think it's time to be alive to the fact that, and I think one thing that I've realized during this time is that you can actually worship at home.
Yeah, it's actually very possible. But there's that scripture that says, it says this, where 2 or 3 are gathered, he is there in their midst.
So the thing is,
the gatherings in this case are not just about just having people. It's also scriptural.
Yes, there is need to fellowship, but I think away from the structure that is a church, we need the future of church right now is I can ask Bitok, who's my neighbor, to come over so that we can watch a service.
Because
my
the Bible says,
the
verse said, I don't know, you can read the verse, but it did not say 2 or 3 people from far.
Yes, you have to leave my house. It doesn't say that
your neighbors, your immediate neighbors, you can be 2 or 3 people, and you can worship. And again, it comes down. Listen, Leah, and I think it also brings us alive to actually the state of the church in this country. Right now, the church has not taken any step in actually the fight against coronavirus. Not even, there are those pastors that used to have revivals. Nikuulize Lea, hii mafuta walikuwa napakanga watu ilienda wapi? You used to have healing revivals, you used to have oil. The church has remained mum and silent. If you look at the history, and this is why I look at it, I'm an historian to some extent, and I'll tell you, historically the church has failed to stand against injustice and disasters. During the apartheid in South Africa, the church was silent. You know, we are talking about the pandemic today, and the only thing we can talk about when everybody who is hearing their services on social media and YouTube and all that, or TV, you only see the pay bill number flashing every other time. They are not asking you if you're eaten, if you're well. So the thing is, it's a tough time for entrepreneurs, including the church.
Thank you so much. Gerald Bitok there, political commentator. Thank you for making time, Gerald. Always good to have you. Agnes Ibara, always a pleasure to have you as well. She is a policy and governance analyst. Thank you for making time, and I hope to get you guys again for another morning. Well, this is the Morning Cafe. I want us to take a look at something a little bit inspirational, something to motivate your day, to make you go out there and, go at life once again with some bit of motivation. Let's just take a look at that video, if my director can run it, and then we'll just go straight to a short break and come back with a lifestyle segment. Stay tuned.